As a patient, I want my doctor to be smarter than I am. I want them filled with knowledge, and I want them to understand how to use that knowledge to confront the challenges before them. I want to see their diploma. I want to know that they were dedicated enough, strong enough, and intelligent enough to make it through medical school. Having great knowledge and knowing how to use that knowledge is what separates you from me and you from your patient. It is why not everyone can become a doctor. Some of us are just not smart enough. It is why doctors are in such demand and why you are so highly respected.
Patients remembered us because we sat with them, because we spent an extra minute at the foot of the bed to learn from them. No matter the circumstances, we can always return to this, to be kind and care for those around us unrelentingly.
A disease that was a diagnosis for death is now a treatable illness. That is part of healthcare's past and future, and science made it possible and makes it possible. Pursuit of science and primary care are not incompatible.
As a doctor, you should always be in command of everything around you. As a doctor, you must listen to your patients. Listen carefully. Some problems are not in the book. Learn to listen to your patients and trust them when they tell you they are sick. They may be wrong at times, but they will appreciate it when you listen.
We have chosen a job where every day the person in front of us matters, and their suffering matters. We should be proud because this is not an easy job.
As a doctor, you must have faith. Faith in your own skills, but also faith in something greater than those skills. You must recognize that you alone are not the sole arbiter of life and death. To believe so is to be terribly, terribly naive. And time caring for patients will show you just how limited your knowledge and your skills can sometimes be. Even the most hard-hearted of patients want their doctors to believe in something greater than themselves. For patients know that all the skill in the world cannot replace the mystery of what sometimes separates life from death. Have faith, and it will take you far.
Our profession is rooted in this compassion, and our collective compassion, be it at the bedside, in the OR, in the lab, or in our advocacy, our collective compassion is truly a form of justice for a suffering world.
A good doctor must know how to heal, not just the body, but the mind and the spirit. Learn to heal. To be a great doctor, you must have strength in times of great anguish. Life is filled with difficult moments. Most of those times we must pass through alone. But there will be times when you, the doctor, must provide the shoulder to cry on, the chest to lean against, the strong arm to hold up the faint of heart. You must be the rock when even the toughest of men and women lose the strength to hold on.
It is no secret that medicine and dentistry have evolved with an unnatural professional separation that is helpful to no one and often leads to unnecessary suffering on the part of patients.
We will face the suffering of our patients, and they will suffer despite our greatest efforts and medicine's greatest innovations. Our patients will suffer until society can care for our poor as much as the rich, until we no longer discharge our patients who are experiencing homelessness back to the streets. They will suffer until we eradicate systems of racism and truly affirm that Black lives matter.
You must walk with a swagger. You must smile with great ease. You should never look tired. You must never get frustrated. No matter how bad your day has gone, no matter how bad your day has gone or what your personal life may be dealing with, when you walk into that small, sterile office or step onto the floor of the ICU, you must do it as if you have done it 1,000 times before. You must be in command of everything that surrounds you.
I'm hopeful because on our diverse paths, if we continue striving for compassion and striving for kindness in our work, for the people we know and those we don't, together, we can make this world a better place for those around us.
Your life must be a constant undertaking to learn more, to hone your skills, to improve your craft, to assure your patients that the answers they seek are within your grasp. You will never have all the answers, but you should never stop searching, studying, asking, demanding, passing on that knowledge that you do have.
Always remember, we are privileged to take care of people. Treat them well, treat them kindly, and treat them with respect. Above all, treat them all equally with one high standard of care. Don't allow missions of mercy.
You must give your patients hope. Even under the most dire of conditions, hope can heal. Hope surpasses all our understanding. Hope is the medicine that gives smiles to the forlorn, faith to the disenchanted, and life to the dying. Give your patients hope.